Welcome to this explainer. Look, cervical screening is one of those topics that can feel completely overwhelming, which is way too clinical, right? Well, today we're going to transform it into a clear, empowering roadmap. If you've ever felt that pit in your stomach when a screening invite arrives, or felt totally lost reading the medical jargon on a results letter, you are absolutely in the right place. We're going to break down the science, the timelines, and the exact pathways of cervical screening so you can walk away feeling completely in control of your health.
Let's start with a massive number. 7. Right now, as we speak, cervical screening prevents 7 in 10 cervical cancer deaths in England. It's literally one of the most incredible public health victories of our time. This isn't just some routine appointment to check off your list, it's a highly tuned, life-saving machine. But to really get the most out of it, we need to understand exactly how it works under the hood.
Okay, let's dive into this. Here is our roadmap for today. We'll be covering who gets screened when, decoding abnormal results, demystifying CIN grades, the LETS procedure explained, and finally, vaccines and the future.
All right, part 1. Who gets screened when? The screening timeline.
You know, it's wild how much the science has actually evolved here. You might still hear people call it a smear test, but the modern NHS process is officially called primary HPV screening. Basically, the lab doesn't just look for abnormal cells right off the bat anymore. Instead, they test your sample first for high-risk HPV. That's the human papillomavirus. And why? Because this specific virus is the culprit behind almost all cervical cancers. So only if that virus is actually present do they put your sample under the microscope to check for any cell changes. It's kind of like looking for the match before you look for the fire.
So, routine screening is offered to everyone with a cervix between the ages of 25 and 64. You'll get your very first invite about 6 months before you turn 25. But, and this is important, notice the big shift happening on July 1st, 2025. The screening interval for ages 25 to 49 is moving from every 3 years to every 5 years. Now, I totally get it. Stretching out a medical test can sometimes feel, well, a little nerve-wracking, like a step backwards. But honestly, I want to reassure you, this is a massive win for modern testing. The science shows a 5-year gap is just as safe because a negative HPV test means your risk stays incredibly low for years afterwards. You are safely covered for a full 5 years. Then from age 50 to 64, it stays at that 5-year interval, and routine screening usually wraps up at 65.
Moving on to part 2, decoding abnormal results, or basically, decoding the letter.
Getting a letter in the post saying your result is abnormal is, well, it's a gut punch. Your heart drops. But take a breath. So the crucial point is this: an abnormal result is not a cancer diagnosis. Think of a colposcopy referral, more like a pharmacist double-checking a really complicated prescription. It's just the system doing exactly what it's built to do, pausing, taking a closer look, and figuring out the safest next step, rather than just rushing you straight into treatment.
And this leads to a totally logical, step-by-step pathway that is just wonderfully formulaic. Let's say you're HPV positive, but your cells are perfectly normal. Cool, you just repeat the test in 12 months. Simple. Let the immune system try to clear it. If you're HPV positive with low-grade cell changes, you get a routine referral to a colposcopy clinic so they can take a closer look under magnification. And if you're HPV positive with high-grade cell changes, you get an urgent referral, usually within 2 weeks. There's zero guesswork here. Every single outcome has a clear, defined, protective next step to keep you safe.
Okay, part 3. Demystifying CIN grades and understanding biopsies.
I really want to emphasize this point and let it sink in. CIN is not cancer. It stands for cervical intraepithelial neoplasia. I know, it sounds incredibly intimidating, but the jump from a persistent high-risk HPV infection to actual invasive cancer takes a really long time. We're talking years, often decades. That timeline is exactly why regular screening works so brilliantly. We catch things at the CIN stage way before cancer ever gets a foothold. And this brilliantly illustrates what those biopsy grades are actually telling us. CIN basically describes how deep those cell changes go. With CIN1 and CIN2, we're looking at mild to moderate changes. And because a lot of these clear up totally on their own, especially if you're under 30, the NHS often just uses conservative monitoring. They safely watch, wait, and retest. You don't always need to jump into immediate treatment. But on the flip side, we have CIN3. These are full-thickness cell changes. Because untreated CIN3 actually carries a meaningful risk of progressing over the years, this is the stage where standard NHS treatment is proactively required.
Which brings us to Section 4, the LEZT's procedure explained and treating abnormal cells.
So, if you do need treatment for CIN2 or 3, the standard go-to on the NHS is called LETS. That's large loop excision of the transformation zone. Now, I know any medical procedure sounds scary, but let's just walk through the steps so you know exactly what to expect. First off, you get a local anesthetic right there in the colposcopy clinic. Second, they use a super thin wire loop with a tiny electrical current to quickly remove the abnormal area, which also seals the tissue at the very same time. And third, you're out the door the same day. The whole thing literally takes just a few minutes. It's quick, highly effective, and super manageable.
Of course, we've got to be objective about the after effects. After a LETS, you can definitely expect some watery discharge or light bleeding for a few weeks. Totally normal. But the real key here is the test of cure. That's an HPV test you take about 6 months later. If that comes back clear, boom, you're right back to routine screening. Now, there are a few recognized risks to keep in mind, like a small increased risk of preterm birth and future pregnancies, simply because a tiny bit of tissue was removed. But your doctor will always sit down and discuss these risks with you individually, especially if you're planning a family, so you can make a fully informed choice.
Finally, Section 5, Vaccines and the Future, Preventing Infection. Now, this is where things get truly incredible, stopping the virus before we even need to screen for it. The HPV vaccine is free on the NHS, routinely offered to 12 and 13-year-olds in year 8. And get this, since September 2023, it's just a single-dose schedule. One shot provides massive protection against the high-risk HPV types that cause most cervical cancers, plus genital warts. Missed it? Catch-up is available up to age 25, and it's also offered to men who have sex with men up to age 45. But, and this is absolutely vital, the vaccine doesn't cover every single strain, and it won't cure an infection you already had. So no, it definitely doesn't replace the need for lifelong screening. They work together as a team.
Which leads us straight to this incredible number, 2040. By combining that highly accurate primary screening with this powerhouse vaccination program, NHS England has set a genuinely profound ambition to completely eliminate cervical cancer as a public health problem by the year 2040. Just pause and think about that. A disease that has devastated so many families, potentially wiped out in our lifetimes? It's just amazing.
We started this explainer by talking about how screening currently prevents 7 in 10 cervical cancer deaths. But public health experts tell us that if everyone actually showed up when invited, that number would jump to over 8 in 10. So I want to leave you with this final provocative thought. You know the science now, you understand the pathways, and you know that abnormal results are safely treatable way before cancer even enters the picture. So, when that letter lands on your doormat, will you attend your invite to help us reach 8 in 10 and wipe this disease out forever? Knowledge is power, guys. Take this information, take charge of your health, and go get screened.